Up north, 2 dead, several others injured. This afternoon, there's a heavy security presence in Boko in the Upper East region as gunmen opened fire in a renewed fighting there. The cause of this latest shooting incident is yet to be uncovered as security personnel have intensified investigations into the matter to avert an escalation. Correspondent Albert Sorry joins us with details on this. Albert, let's get to it. Tell us exactly what is happening up there and what may have led to this shooting incident which occurred. Give us some updates.
Yeah, so this latest incident occurred yesterday afternoon between the hours of hello.
Albert, I'm here with you.
Yeah, so this latest incident occurred yesterday afternoon at about 12:30 when some unknown gunmen fired into a park where people normally go to board tricycles to their various destinations. You'll recall that motorbike riding has been banned in Boko indefinitely because of the security situation there. And so, in some parts of the town, you have parks like lorry parks where you go to board vehicles. You also have places where people go to join tricycles. And so this was the place where this incident took place yesterday afternoon. It's very close to the Boko police station. 6 people, sustained gunshot injuries. We're told that one of them died on the spot. The rest were taken to the hospital. Um, they were admitted at 2 different hospitals, the Vineyard Hospital in Boko and also the Presby Hospital in Boko as well. This morning, one of um, the patients who were receiving treatment also died. We're told that this is a 19-year-old young man who passed away also this morning, bringing the death toll from that incident to 2 people.
I see.
The rest are still receiving treatment
Mm.
in these hospitals
Uh,
that I earlier mentioned.
and let's talk about the incident relating to the staff of the Bogatanga Teaching University, Technical University, I should say. We understand that that individual has been killed as well. Is that related directly to, these clashes at North?
Well, so what we are told is that this lecturer is also a native of Boku. That is all we know about that incident. He was attacked at his home, but this is a separate incident which occurred in Bolga. But because of the shooting, which also coincided with this incident, some people feel that the two might be related, or there are even fears that maybe people from the Boko area who are involved in this chieftaincy dispute are starting to attack each other outside of the Boko town. It's one of the concerns that people have. But as we speak, because of our inability to get the police to comment on this matter as we speak, we are not able to tell whether there is any proof that these two incidents are linked whatsoever.
I see. And speaking about authorities in the area, it's been almost 24 hours after this attack. Any comment at all from either the Regional Security Council or any other political leader or security agency in the area?
Yeah, so I've been making efforts to speak with Amadou Hamza Zanga, who is the Boko Municipal Chief Executive and also the head of MUSEC. Our efforts in the morning were not successful. He later replied to a message that I had left him saying that he was busy and so he will get back to us later. Since then, we haven't been able to speak. The impression I'm getting is that they are still doing the investigations because one of the things that also happened yesterday after this incident was that there was a whole lot of, reprisals. The two factions, from what we understand, may have opened fire on each other. We do not know whether there are any casualties resulting from that. But what we know is that yesterday during curfew hours, there was a whole lot of shooting happening in Boko, in the Boko municipality. and we're told that the security had to also, try to calm the situation down. And so that's what we know. Because of this, we are thinking that the RECSEC, together with the Boko Municipal Security Council, have been busy, and that is why they have not yet responded to us.
And indeed, we must point out that many attempts have been made by political leaders, including the Vice President himself, who was recently in the area, just to try as much as possible to bring all the feuding factions together. Why, in your estimation, is it the case that all of these efforts are not working?
Well, if you speak to many people, it appears that the conflict in recent times may just even be drifting away from its original cause, which had to do with the disagreement over the chieftain. It's more now, it is more engaged people, most people feel that people get shot at, and their relatives or their members of their own ethnic group also feel that they must retaliate, and that is why these incidents continue to occur. Before, and it was an incident where another man was also killed less than a week ago. So in this new year, in this already lost relation, and so many of the residents, are wondering when this all going to end. Development in the area, when it happens a lot of schools have to close. So in some of the areas, children don't even go to school regularly anymore because their teachers, cannot come. So if someone, for instance, belongs to one of the ethnic groupings and he has to go to the other side to go and teach in a school there, the person will be afraid to do it. And so some teachers don't even go to school at all. We remember there was an incident where the Ghana Health Service also indicated that people who have HIV, in the last 1 year or so, have not been able to get access to their drugs because the medical personnel and the health officials are unable to work in Boko. Even the National Health Insurance had similar complaints that they cannot register people onto the scheme. And so it's something that is affecting then, life in general in Boko. But nobody knows when this is all going to be over.
I see. Grateful for your time. Albert, sorry, providing us with some updates of the latest in the Upper East region. And we are taking a look at the concerns of the Senior Staff Association of the public universities across the country who have declared a strike, indicating that their members who are charged with providing critical administrative roles across public universities will be withdrawing their services nationwide, giving governments redundancy or perhaps dormancy in resolving their concerns regarding conditions of service. We've been interacting with some leading figures of the group, and here's what they've got to say about day one of that strike.
So the Senior Staff Association KNUST chapter have begun their first day of protest against government's decision to scrap their 50% basic allowance, which they have been taking over time. According to them, government started to scrap this allowance last year, November, without their consent. They are protesting against government decision, and they say they would not return to work until government restores this 50% basic allowance.
Our main issues are two. The main issue has to do with our tier 2 that government has been holding and has not paid since February of last year. That is our main issue. And this issue has been an issue that we have gone to government on so many occasions trying to let government address this issue. But government has refused to address this issue. Some of our members have gone on pension, and when you see the amount of money that they have been given, you realize that government is actually making things difficult for us. That is our main issue. And the second issue is about information that we have gathered that indicates that the government is going to reduce our allowance, that is the overtime allowance, fixed overtime allowance, from 50% to 10%. The government is giving a new name to the allowance, call-in allowance. This has been an arrangement that we have had for a very long time, and we feel that this is going to have an effect on our members. Imagine your salary, you've been reduced to that level. These are issues that are so concerning to our members, and that are the two main reasons why we have gathered to embark on this industrial action.
Nah, yeah, go for the young people before. Nay, let's see your panel. Say you did bring your Marco school. And you buy your has say your bad night. Yeah, say, election year. You bet sweat, you power rough. You are you really see them say, or restore allowance in my crime, see a bet sweatiano. You are in a papa. It's the same person you knew Kunia, you need ye, or Pemswa, but you knew now none more. And as I said, you are by no creators as fancy mine, one pay and put to a back of crime. Nanakufano, you bet sweat, you rough.
My is that any government that comes, if you are not increasing our pay, what we are already on, you are not supposed to take it out. And now you have not increased our pay, you are taking what we are already enjoying, which is very bad. So he should think twice and then restore our allowance for us.
So when they are to resume work is not clear yet. According to the association, they would only return to work upon government's decision to restore their 50% basic allowance. For Joy News, my name is Nana Boachidankwa Kumasi.
And from the Ashanti region, we head up north to UDS, where Martina Bugri reports.
The various departments of the University for Development Studies have come to a halt following the declaration of the strike by the Senior Staff Association of Universities in the country. The union met to declare their support for the strike announced by their leadership. Speaking to the media, chairman of the Senior Staff Association of the University for Development Studies, Mohammed Zakaria, said if government indeed prioritizes universities in the country, it should have addressed these issues before the universities resume.
The implications of the government actions are unacceptably severe, particularly for retirees from 2020 to 2023 who have been denied their rightful lump sums and are currently facing abject poverty and illness in their own houses for after a year of dedicated service to the public universities in Ghana.
We are not coming back to work. Sure. We know it is counterproductive, but we are saying that government of Ghana should be held responsible for all the suffering that will arise as a result of this strike. It's unfortunate, as we have indicated, that this is the time that the academic and administrative work is in full year. But government should have looked at that aspect and listen to us and solve the problem. But government failed to do that, putting the poor students of this country into trouble. Because now we are packing back and baggage. So if government of Ghana is serious about the tertiary educational activities in Ghana, government should listen to us within the shortest possible time. But if government of Ghana thinks that tertiary education is not a priority to it, then fine, we are fine with it. The people of Ghana, we are all watching. It's unfortunate though that we are saying that senior staff is not responsible. The government of Ghana is responsible for all the suffering of our staff and the students. That's exactly what. So today, we have declared an indefinite strike. Indefinite means indefinite. We are going to put in place a task force. If we get you in your office, we will take the right punitive action against you.
Meanwhile, some students of the university are worried this would affect the academic calendar.
Yeah, so as you know, after COVID, the academic calendar was distorted. So coming into this year, 2024, we're expecting that if all things being equal, we are going to have the academic calendar back to normalcy. And here is the case: Senior Staff Association have gone on strike. As you can see behind me, we are doing freshers registration. We started last week. And then right after they leave here, they have to go to their various departments to make verification. You go to the offices right now, there is nobody there. And if you are not verified officially, you are not a student. If you are not verified officially, you are not counted as a student. Let me put it that way. Yeah, so since they've gone on strike, it's going to affect studies because after verification, that is when you can proceed to class. But then here is the case, you can't even go and verify.
This strike is really going to affect us a lot since our lectures are very important when it comes to our academics. That's mainly our purpose here. And then as of now, academic year has started and we are just roaming around as students. We are not attending lectures, nothing, just because of this particular thing. So we are just pleading with the government. We are really pleading with you so that lectures, you help our lectures so that our lectures can come on.
And James Banon Yakubu is the trustee of the Senior Staff Association, Universities of Ghana, speaking to me earlier.
Not that I can say, but what I know is that before we went on the industrial strike, we have written letters to government. Before you embark on such a strike, you need to notify government at least some number of days, like 2 weeks. We did that on the 4th of January. We didn't hear anything from them. And then after we declared the strike, I saw some communique flying around. I don't know how true it is that Labour Commission is inviting us for a hearing. That I'm not too sure.
Have you received that letter officially?
Officially, not that I can say, yes.
But what the social media one suggests?
Yeah, sometimes something like that. Sometimes things can fly. Right. So once I didn't get that official notification from the national seat, I cannot say that.
But are you willing to engage?
Oh, why not? Why not? We are employed in the university to work. And nobody is happy to be at home, including myself. Look, my brother, let me tell you, sincerity, this strike, I'm not happy about it. We are taking it as a pinch of salt because I have my case at the basic school. And the basic school is going to be affected. These children will be at home. Us who have worked in this noble university 40-something years, 50-something years, and they cannot access their lump sum when it comes to pensions. This is a very serious issue. If we think that we are not thinking about now, we will also go, and the same thing will follow us. So why won't we let government know now that we are active? We should fight for those who are inactive, so that at the end of the day, they can get what is due them. How can you work in the university for more than 40 years? You go home, they give you 2,000. 2,000, some of them 1,500. These are the realities on the ground. No university worker is happy. As when it comes to our pensions, they don't respect us. They do it anyhow. You go sometimes.
When was the last time you engaged government?
We have been engaging government on this. You can remember our last strike. It was the same thing. They owed us some arrears from 2010 to 2016. Then we fought government. Government paid the principal, and then they didn't even use the appropriate rate. That normally the laws of the pension are very clear. When you default for a number of when you default, there is 3% penalty slap on the default period.
Okay, in this period, the default period now is?
The default is 11 months.
Right, 11 months.
Yes.
So you have to pay.
You have to pay with the interest. And the one they paid last 2010 to 2016, they used some a simple interest instead of the percentage rate, which did not go well with us. We were actually so changed. We didn't get the value for money. You get it? So the law is clear. This time around, we are going by what the law says. That once we default, you must apply the appropriate penalty sanctions as stipulated in our communique when we call.
The final question now is, if government wants to negotiate or talk with you at the National Labour Commission, it would then mean that you have to call off the strike. When it gets to that point, will you call off the strike? Will you call off?
No, we will not call off the strike until all these things are finalized. We can be on strike while we engage with it. It is not.
Would that be engagement in good faith? Because usually the National Labour Commission will ask you to call off the strike.
Commission.
Will you call off first before you engage?
We will never. We don't call off strike while we engage. We know that we have already informed them. We have followed the due process. So we've given them that 2 weeks notice, and they are aware. So if they are calling us to engage them whilst, they appeal to us, to our conscience. But I'm saying that this issue has been lingering for quite too long. If we look at this strike, actually, we have closed everywhere, including security, hospital, and then basic school. This normally when we go on strike, we exempt some areas to work. But this time around, we have locked everywhere. So we want them to actually solve this problem once and for all. We believe Ghana, there's money. I don't want to hear there's no money issue, because this country is rich. This is a rich country. We have everything. We have gold. We have everything. There is no mineral that we lack in this country. Let's treat our workers with some kind of decorum and respect, and then ask them to give out their best. Because if you treat me well, I will give out my best. If you have your wife at home and you don't treat her well, you will see the difference. It's just the same thing. Our management, including government, are not treating us very well. Recently, they are trying to touch our free hospital care. All these things, how will you do that and you expect the worker to give of his or her best? These are the things we are talking about. And nobody should think that the university worker, we are so much interested in going on strike. No. Our interest is not strike. If governments solve our problem, we will come back to work. Because staying at home, what will I gain? Yes, sir.
Thank you. On to health, Ghana's vaccination and immunization against 6 childhood killer diseases could face a major setback this year if the government fails to meet its co-financing obligations under the Gavi vaccine initiative. According to stakeholders in health, the government of Ghana in 2022 failed to meet 100% of its co-financing obligation and only paid in the first quarter of 2023. For 2023, the government made full payments of its obligation in 2024. Let's get on Zoom now and bring in Dr. Hilda Boy of the Pediatric Society of Ghana. She's joining us via Zoom now. Thank you so much for spending some time with us. For those who are not, familiar with the technical terms of these 6 killer diseases, how important is it to the development of children? And kindly unmute for us so we are able to get your concerns.
Hello, good afternoon to you and your listeners. I'm not the CEO from Pediatric Association. I'm the Executive Director for Hope for Future Generations.
Apologies for that. Cecilia, welcome to the show. All the same, you're equally concerned about what's happening, just as the Pediatric Society is. And so we get to that straight off by looking at the concerns of your group as well, the Hope for the Future Foundation. So for your group, I'm just wondering what your perspective is on this matter.
Okay, so thank you very much again. We appreciate what the government of Ghana is doing and to ensure and secure the future of our children and pregnant women. And so we are calling on government to meet its co-financing obligation to Gavi. Very important, the 2023 government has done very well to pay 60%, and in 2024 we heard that government has paid the rest of the 2023 co-financing. We just want to be sure that this is done, but from the feedback that we are getting from key stakeholders, government has paid, so that is it. But the important thing is that early payment of this co-finance is important to give the opportunity to Gavi to secure vaccines for Ghana, for our children. And so our focus or our call on government of Ghana to ensure that the co-financing for Gavi is paid early enough to enable Gavi get the vaccine for Ghana so that our children can be immunized, so that we don't face shortage of vaccines in the middle of the year.
The government is currently facing undoubtedly an economic challenge or crisis. In the wake of this, what recommendations are you making in terms of funding? Because that will be a key challenge.
Well, we know government is facing challenges, but should we leave our children to die from preventable diseases? We know that investing in vaccine is the biggest investment you can do, because if children fall sick, what will happen? The government will end up spending a lot of money. And we all believe in prevention is better than cured. We wait for children to get measles, to get diphtheria and all other diseases before we go and be buying drugs and looking for treatment. Look at the struggle that our health system is going in. Health financing is becoming a challenge. We have our systemic issues already. We have our bureaucratic issues.
It's the
our
same
children
reason.
shouldn't suffer that because we are not able to meet their needs.
Yeah,
we
and
should
it's
not
the main reason
the
for which I'm asking the question. The government, in the wake of COVID-19, of course, brought about the COVID levy post the pandemic, and that's why I'm asking if there are any immediate solutions in terms of financing.
Okay. So we are still contributing to the COVID levy, and so stakeholders are calling on government to turn that COVID levy that we are contributing for health and also meet its co-financing obligations, not only for Gavi but also to Global Fund. I think we are not meeting our co-financing obligation. How can we stay on our own if our health is depending on donors? I don't think that is what we all want now in this country. Grateful
for your time, Cecilia Sanusi, CEO for Hope of the Future Foundation, joining us here. The stories we're looking at also include what's been happening in some of our hospitals across the country, because in the heart of the Busan North municipality in the Upper East region, within Sandema Hospital, originally designed to be a haven of care, stands in the state of disrepair. Whenever it rains, the hospital's roof betray their duty, leaking profusely. The structure has not escaped the ravages of time, displaying gaping cracks that question the integrity of the infrastructure. Health workers and patients say they find themselves in an unsafe environment. For a closer look into this uncertain reality, join my colleague Jojo Kobina in the first episode of Ghana's Sick Hospitals.
So can't you see, mommies and puppies, the sweat, you know that this be like the ice to your chest. So can't you?
It is an ultimate walk of shame for any visitor to the Sandema Hospital in the Busan North District of the Upper East region. If you were blindfolded, dumped here in the corridor, and the cloth is pulled from your eyes, you could never guess that this place is a hospital. The walls are dirty and the paint almost peeling off. The ceiling is moldy, greenish brown and rotting away. The corridors are dark and dingy. The medical superintendent of the hospital, Dr. Emmanuel Opoku, is unhappy with the state of the hospital, but he's also very worried about the safety of nurses and patients because of the gaping cracks in the walls.
When it rains, almost all the walls leak, including the medical suite's office. And during rainy seasons, it makes seeing patients very difficult, because sometimes you need to get to a safe place to cater for the patient, and we'll be grateful if you could get help.
As the head of the facility, he works with the news team to show the dangerous state of the facility. A substantial and alarming crack traverses the length of the wall, extending from floor to ceiling.
So this was formerly used as a dispensary. But because of the nature of the cracks, they have to move to the other side.
Every part of the almost 94-year-old hospital leaks badly.
So why are you still working in a place that you don't feel safe?
And if
I ever had an accident or something happened to me and I need to visit the hospital immediately, this is where I'll be rushed to. I will just quickly rush into the consulting room 1 to see exactly what is happening there.
This room is where patients receive care from doctors and physician assistants. But a cursory glance shows the room is not hospitable. Just like the corridor, the walls are crying for a fresh coat of paint. The leather upholstery of the chair for patients is badly torn, exposing a dirty brown cushion. The state of the furniture is so bad that you would rather consider standing to receive diagnosis. The floor tiles are broken, weak, and unsafe. Although the state of the consulting room is nothing to write home about, physician assistant Erica Yariga has bigger worries.
Safety, as you all know, it's a universal demand. It's a basic, fundamental thing. But safety in my consulting room with what I'm seeing, of course, no. However, once we are mandated to give services, we have to sit under such conditions to be able to render services to the less privileged. So safety, I'll say no.
Mary is nearing 70 and a native of Sandema. She witnessed the hospital lose its luster over the years. She's passionate about the children's ward, which has also deteriorated. So, we entered the children's ward to get a sense of her concerns. The ceiling paints a perfect picture of neglect. Mold growth is evident, and this can be attributed to leakage caused by persistent rain. A fetid, unpleasant odor wafts through the children's ward, further emphasizing the impact of the water damage. The wooden window frame shows clear evidence of decay, with sections displaying a spongy texture in some areas, leaving the frame structurally compromised. Residents of Sandema are not happy with the state of their hospital. 45-year-old Jerry Atimbi Akanawe leads a group called Common Interest to address some of these challenges. But resolving the poor state of the hospital is beyond them, so they want the government to step in.
We've done a lot about this district and some department, but for the hospital, it is something that when we heard about the hospital state, we came to the management to find out the problems, and we realized that the problems were beyond the hospital itself. Most of the offices, from the OPD to even the doctor's office, to the children's ward and other places, are all just in a bad condition.
In fact, I managed to pull him aside to have one-on-one on him. And he said I should write. I did. I wrote a letter to him, to the Minister of Health, concerning our hospital, the sorry nature of our hospital. It is so terrible. I was pleading with him if he can put us on agenda 111. And then he said for now, as at that time, they will look at it, so I should write. And I've written the letter. But I'm hoping that something good will come out of it. And then at the meeting with head of department and then donor partners back at Bolga Regional Coordinating Council, I made a cry about the hospital.
The Municipal Chief Executive, Vida Akantagriwen Anab, is supposed to provide solutions to this problem, but the Municipal Assembly is broke. With less than a year for her tenure to expire, she has one wish.
If I have one word, I want government to work on our hospital. It's now a municipal hospital. That is the referral center. And it's not for only for Bulsa. We have Bulsa South, they refer here. We have Kasana Nankana West, they refer here. We have our neighbors, the Mampursis, they refer, it's a referral center. And so they should work on our hospital for my people because we are suffering.
She hoped that the government would build a new hospital under the ambitious project of constructing 111 district hospitals, but Bulsa North was not considered.
So for the hospital there, like I said, that was where I was working as a midwife. And I'm now on retirement. And looking at the hospital, it is just not good. I am pleading with the Minister of Health and then to Dr. Nshiansare, if they can come to our aid. It's so sorry. The people are really suffering because of the hospital. Yes. And because of that, so many nurses are running away from the hospital.
Well, as the MC and others complain about the poor state of the hospital, some patients question the essence of your hospital, which cannot provide simple gauze and other essentials for dressing wounds.
And when you say, what are we?
What's it?
No, I could talk banning they are the back at us and listening, and then they are gross. The wing and I just saw talk.
How come say we all day matter inside we all day suffer?
Mary says although she has a valid national health insurance card, nurses always tell them to bring their supplies because the government has not fully reimbursed them. What do you call a hospital that cannot provide simple supplies like gauze for dressing wounds? A sick hospital in need of healing. Jojo Kobner, Joy News.
Thanks for staying with us here on The Pulse. Now, the 2022 Ghana Demographic and Health Survey report has revealed that the number of women that are overweight are more than twice as men. The report specifies that 50.2% of women aged 15 to 49 are either overweight or obese, with 20.7% of men within that age bracket also either overweight or obese. Government statistician Samuel Enim added that people in urban centers tend to be weightier than those in rural communities.
The issue of obesity, but both from the children perspective and the adult perspective, the conversation on obesity would always have to be looked at from the perspective of the drivers of obesity. Prior to the statistics on obesity, we showed our consumption patterns in terms of women that are consuming diversified food and women that are consuming unhealthy food. And what we put out there is that we have about 50% of our women aged 15 to 49 years that are consuming unhealthy food, specifically French fries, the chocolates, all the food that comes with heavy oil base are identified as unhealthy food. And this has translated in we seeing that about 50% of our women are either obese or overweight, specifically about 22% of them that are obese and 28% of them that are overweight. While we see lower numbers for males, but it's still a matter of concern. About a fifth of our men 15 to 49 years are either obese or overweight, specifically with 3.9% of them being obese. We see a relationship between children that are obese and their age. We see a higher percentage of those 0 to 6 months that are obese, specifically about 8.2%, and this figure reduces to about 2% for children within the age bracket 40 to 59 months. What we've realized is that of the 17 Sustainable Development Goals, the Demographic and Health Survey is able to give us information on 7 out of the 17 Sustainable Development Goals. For instance, the Sustainable Development Goal 1, which touches on no poverty, through the data collection around issues of health, wealth, and basic services, we are able to provide an updated data on no poverty. The same applies to zero hunger, good health, quality education, gender equality, and also partnerships based on the proportion of people that are using internet services.
Well, joining us in studio now is Godwin Odejabi, head of Demographic Statistics, Directorate of the Ghana Statistical Service. And thanks for your time here in studio with us. Of course, I'm just trying to go through a number of very interesting findings that we see in this very document. Quite a simple one that you've summarized for us, pointing out a number of issues relating to demographics and health, which is very critical for any nation that wants to develop. But let's start off with this concern about women's nutritional status across the country. The fact that, quote, 50% are overweight or obese, as the report is finding out. What's the implication?
Well, thank you very much, and greetings from Ghana Statistical Service. Today we launched the 2022 Ghana Demographic and Health Survey. The main idea behind this is to look at our population and health situation. So we look at a number of issues relating to fertility, child mortality, nutritional status of women and children, and then also our lifestyle. So one is the issue relating to our weight and height and all those things. So we did that for children and then women. So, and then it's also got to do with our dietary issues. So if you listen this morning carefully to the government statistician, he made mention the proportion of women who possibly take what is called dietary practices. And we have the minimum dietary diversity, which the preferred one, and that one is the 50%, where, and then also those who have been taking sweet beverages, and then also they form the 37%. Then we have the other group, those who have been taking the unhealthy food, they constitute 28%. And all this have implication on our life. So it's one of the key issues which we pointed out today in the lunch.
I see, and I'm concerned about women, as I was pointing out earlier, about their dietary condition.
It has and health implications.
Yes.
It has health implications. As we overweight, yet it has implication on our health. That's we are inviting diseases to our body because we've not been exercises and all those things. So it's a concern, it's a policy issue which we need to address, looking at the figures.
I'm looking at the age distribution, and it's somewhere around 20 to 49.
Yes.
That's quite a youthful population there.
Actually, yeah, the Demographic and Health Survey for women, we pick information from 15 to 49 years. So that cutoff, 20 to 49, as a key issue. And these are the time women will be in their reproductive age group. So once they become obese, and issues relating to pregnancy will definitely affect the other. So we're using the DHS to monitor our health programs.
And to be fair, also, there's also the provision for men. It's not as though this is all about women. And also, you've been looking at some critical aspects to children's nutrition and how the issue of stunted growth has become a national challenge. I'm looking at the national distribution here with significant figures, for instance, coming through from the Northeast region, 29%, as high as 29%. And of course, you have the Greater Accra region. The figure is not too clear there, but they are equally experiencing some very worrying percentage points. Why are we seeing the increasing case of stunted growth across the country?
Yes, it's got to do with the nutritional status of those children. And looking at one's age and height, supposed to achieve a particular nutritional status. So putting all these things into consideration and being measured in a standard way, you'll be able to measure those who are standard by looking at the person's height to age and all those things. And then And it's all boiled down to the nutritional status of these children. So it's cut across. Even though we've done well over the years, but then there are still variations in terms of the nutritional status of children, as you've mentioned, and what we had in the morning.
The infant mortality rate also coming down significantly, as we're seeing on this chart you've provided, giving us a trend of what's happening across the country. It appears we're doing well, looking at the figures from the 80s as you've tracked it, all the way to 2022. Have you gone back to check perhaps what's accounting for this? If this is more driven by medical infrastructure, or perhaps it's just a case of advanced technology, if we should put it that way.
Yes, we've done well, because if you look at where we're coming from for the infant, as far as 77 deaths per 1,000 live births, that is 1988. Now it has come down to 28 for the 2022 Demographic and Health Survey. Let's see that we've really come far. And it's got to do with practices and then behavioral issues. Issues like children attending to healthcare facilities when they are sick, and mother attending to the children, and all those things. Also, will reduce the infant mortality if we're able to take all these things into consideration. So I can say that basically our practices, healthcare issues, seeking healthcare at the appropriate time will all reduce the what is called the infant mortality, as well as the nutritional status of all these children. If they are not malnourished and all those things, will definitely help us to reduce the infant mortality. That is the reason why you've seen the figures.
Yeah, and again, you're painting a national picture, giving a regional breakdown as well. And here again, somewhere up north in the Upper East region, you have the figures surging really high. Is it the case that there's some peculiar challenge with the northern parts of the country in terms of stunted growth? You have, child mortality also facing quite a significant challenge there.
Yes, so as I mentioned, though we didn't ask why there's this high death in the district, but then you can use from issues relating to health issues and practices. Compared to the southern part where we've been having access to health issues. So if you look at what was presented this morning, we look at the distance to the health facility.
Okay, so that could be another contributor.
Distance to health facilities. We look at those who do more than 2 hours or more. So from as low as 0.8% in Eastern region, yes, we have as high as 11.6% in around OT side. So
once you start going up north, there's a challenge of access, or perhaps proximity to.
Not really because we've not done scientific that when you go up, yes, but then
the trends are showing that the numbers are higher up there.
Yes, the numbers in the northern part of Ghana, the numbers are high, and it is not what is called a recent issue. It's if you look at the time we conducted the DHS survey, from 1988. Yes, but it has been coming down, but we can still say that it is still high.
If there's anything the nation needs to be picking up from these findings you're putting out, what recommendations are you putting out there, and why would you say that these figures that you're putting out in this latest report ought to be taken seriously?
Yeah, so we if you look at our findings, we attempt to compare it to our national target and the global SDG goals to see whether by 2030 we'll be able to achieve some of these SDG indicators. So issues relating to access to health facility, the more closer it is, the more people can, or the population can have access to this health listing. And then also the times we visit the what is called the hospitals, the clinics, also is an issue. Once there's a sickness, and then you are able to visit there at that same day, that would be better because you have access to
faster response
compared to those who delay in going to the distance. So putting all these things together will account for our health status, whether we're doing well or not.
Are we going to make that target based on, the projections you're making now and all these figures that you're putting
Yes,
together?
Ghana, we've done very well. And if you look at what is called the infant mortality rate,
Right.
now we're hovering around 28, but the expectation is that, yes, it should be maybe less than 12. Then the under 5 will be less than 25. So if you look at where we are now, under 5 we are at somewhere 40 deaths per 1,000 live births.
Yes.
As to whether by the 2030 we'll be able to achieve this, is what we need to fight for. We need to work towards it and see whether by 2030 we should be able to achieve the under 5 and then the infant mortality target.
Would you say that we need some more time beyond the 2030 target to at least deal with some of the
No, the
issues that
the
we
target
have?
is the 2030.
Yeah, that's the deadline.
Yes.
Or that's
So
the timeline.
what we have to do is to work towards the 2030 through health intervention programs and all those things. Then we'll be able to reduce the infant to a bearable minimum to hit that target.
Yeah, but if it took us more than 10 years to get to where we are now.
Yes.
Going by the rate at the decrease.
Yes, so we may be able to achieve some
going
of
at
the
the
targets.
decreasing rate. You obviously know that will
we
be
may
a
be able
challenge
to
for us,
achieve
right?
some of the targets. Some too we may not be able to achieve.
And which one do you predict might be?
No, I will not
for us?
predict now. I will not.
Yes,
predict
because
now.
I'm just looking at the
Yes.
numbers and trying to make sense of them.
Yes, I think
from 1988, for instance, as you're putting
the beauty of it is
to 2022, it's moving from 77, bringing us to 28 per 1,000 live births, right? So we still need the same period of time, or at least half of it, to clear everything out.
Yes, so if you look at where we were in 2014 for the under 5 mortality, it was 60 deaths per 1,000 live births. And then by 2022, yes, we moved to 40. So it's possible we can achieve, looking at the way we're going down to that level.
Right.
Yes, it's possible we can achieve some too, we may not be able to.
And I was talking about the recommendations earlier, and if there are some recommendations you've put into this document, at least to inform policy and to inform action from stakeholders, what would that
Yes,
that be?
definitely. We've been working with Ghana's health service in monitoring of these programs. So if you look at the issues we raise, one is got to do with the seeking of services. So the campaign should go on. And then also proximity to these essential facilities. We should look at it and see how best we can minimize the distance people travel in seeking health services. All these things are some of the issues you can pick on and then make recommendation so that once we work towards it, we'll be able to reduce our infant and under 5.
And to be fair as well, your findings end at 2022, which means that we have, a 2-year lag, if we can put it out as such. If we're to carry out a survey today, looking at some of the findings you've made, do you have a sense of belief that things might either have improved or decreased?
Yes, so once we've launched this report, Ghana Health Service have been using the report to study the report and then improve on the services that they've been delivering. So that is the reason why you see most of the indicators going down because of the data they've been planning with and then working towards that they will be able to reduce those what is called areas where we think are high to a bearable figure for us to sometimes achieve the SDG targets.
The World Bank, the Global Fund as well, are all partners in this project. The issue about funding, that will be critical if we want to speedily beat the curve, as some experts will say. How crucial is the issue of funding, both to...
No, for funding, I think I may not go there because I will leave that one for the Ghana Health Service. But for funding for data collection and all those things, and then coming out with reports and all those things, I think we are doing very well.
Well, we'll have to leave it here. Thank you so much for spending some time with us here on The Pulse. And that's it about the 2022 Demographic and Health Survey. A report there for you by the Ghana Statistical Service. But we stay on the environment because the Environmental Protection Agency, EPA, is charging the private sector to explore positive aspects of the climate change effect. The CEO of the EPA, Dr. Henry Kobina-Kokofo, speaking at a carbon credit agreement signing between the Jospon Group and EKI Energies, said though climate change is negatively affecting human activity, it also has a positive aspect. He therefore strongly urged Ghanaian businesses to explore the positive side of climate change to make climate-smart investments.
Change is impacting the people in several ways as the country sits at the intersection of three hydroclimatic zones. Changes in rainfall, weather conditions, and sea level rise will affect the salinity of coastal waters. This is expected to negatively affect both farming and fishing activities. However, the Chief Executive Officer of the Environmental Protection Agency, Dr. Henry Kokofu, speaking at a carbon credit agreement between the Jospin Group and EKI Energies, said Ghanaian private sector businesses must explore the positives of climate change.
There are lots of advantages out there, particularly for the private sector. And Jospin Group of companies, Dr. Ejapon has done so well leading the way and the pathway. We've been talking about climate change effects, the negative aspect, but there are positivities, and that is what you are witnessing. There are climate-smart investment out there, 175 different areas that one can invest in, running from nature-based solutions to built environment solutions, whereby recycling, reuse, and the circular economy closing the circuit. So it is a very good example. It is for all of us to see that going forward, climate prosperity plans also involves the private sector, non-state actors to come on board to play.
The $1 billion carbon credit agreement between the two companies is to boost Ghana's carbon credit rating over 5 years and also to give the Jospin Group an exclusive carbon trading right with EKI Energy Services. Joseph Siawe Japan is the CEO of the Jospin Group.
Briefly, it's partnership and collaboration. We all know that the world now is into carbon, it's into climate change issues, and as Jospin, that we are yet coming in. We needed a partner strong like EKI to handhold us so that we can develop very strongly into that market. So it's a collaboration in terms of technical, finance, and development so that we can get into that space of business very, very strongly. So this year, 2024, we're going to map up strategies of how developing better into this market by taking each segments very strongly and then seeking the technical advice of Ministry of Environment, in the person of Dr. Derry and Dr. Benefo and all the other carbon credit officers. And then also with EKI coming in, I think that we're going to go a long way for carbon issues to help this country, Ghana, and as well as everyone.
The CEO of EKI Energy Services, Manish Kumar Dabkara, assured of the company's commitment and readiness to execute the agreement.
So since we do have supplied more than 200 million credits till date, and we do have very good expertise to work on various different programs which are there in the international carbon markets, various different technologies which are located in various different nations. So we do have very good technical expertise to execute the project right from the project installation or doing EPC, getting the project registrations, getting the project verifications, and then ultimately sell the credits in the international carbon market to gain the carbon finance for the investors. So this is the specific technical expertise we do have.
With the Jospin Group taking the lead in exploring the positive aspects of climate change, it is expected other sectors of the Ghanaian economy will follow suit to increase the country's carbon rating.
And you're watching The Pulse on the Joy News channel. We'll return shortly. Well, if you've been around for some time, you would have a very high regard for this brand, Ghanaian Times. At some time in the 90s, it was simply a fashion to buy graphic and Times, even if you cannot read. Such a great product is now undergoing some difficulties. Of course, workers say the news products are no longer sustainable. Its printing machines have been sold under controversial circumstances, as has been alleged, and also staff have not even been paid, as we understand, since December 2023. This is the very sad story for the New Times Corporation. The workers have enumerated all of these concerns in a petition sent to the National Media Commission. We can bring you excerpts of that petition to the Commission, which you see on the screens right now, pointing out a number of issues. First of all, talking about the sustainability of the new products the company has, the controversial selling of some printing machines, as has been alleged, and also selling of almost all of the vehicles supposedly belonging to the company, and the issue about leasing more than half of the corporation's property to some investors, as the reports are pointing out. But what's happening at the print media business in Ghana, and is the taste for news print shifting? Well, these are the questions that we're asking this afternoon, and joining us now is Emmanuel Oparijan, National Organizer of the Private Newspaper Publishers Association of Ghana. Emmanuel, thank you so much for spending some time with us here on the polls. And of course, just as I was pointing out, the Times Corporation is a very respected brand, but it appears that there are some difficulties there. Help us understand and appreciate what's happening to this brand.
Thank you very much. I think we are looking at the newspaper business or the industry together. And the challenges of Ghanaian Times are common to a lot of media houses as we speak. Basically, maybe Ghanaian Times is looking at the management level and the challenges of their management, thinking that maybe is the happiness of leadership. But if you pick the industry as a whole, I see it as a challenge to the industry where there are new challenges and new development in the industry, and therefore there's a shift of patronage to the newspaper, a decline in sales, advert is not coming because of economic situations and others. If Ghanaian Times issue has to be addressed, then I think I see it more of a governmental intervention.
I see.
For the industry. Even if the best economists is sent to Ghanaian Times to manage,
that will be a challenge.
There will be a challenge.
And in fact, I'm glad that you're pointing out that this is an industrial challenge. The newspaper industry appears to be suffering some challenges because of the advent of technological advancement and all of that. But we see some of the states, newspapers, aside Times, trying to upgrade or perhaps move on to new media and bringing on board some new policies. Is this something that others within the space should be considering at this time?
I think what has to be done in Ghanaian Times is to let them appreciate where we are now, the new trend, the digital space, subscription-based, digital subscription, others is where they have to encourage. If they don't have the equipment to do that, I believe that this is the time they should use the challenge they are facing now to transform into that sector of development where is the new way to go. Because if you pick the physical newspaper, as we call it, the sales is declined across the country. What is currently sustaining the industry is a little bit of subscription. That is fiscal subscription. And it's basically done by the state.
But let's look at the examples elsewhere, because you're very experienced, so you understand what happens elsewhere. Can't we adopt some of these best practices out of Ghana and just adopt them into our system so we can sustain these newspapers?
Yeah, it's now, these days, it's even common to read what is going on, the trend. That's what I said, the digital level is what is. Digital subscription is key now in the newspaper industry. And that is where a lot of the newspaper business are going. If you pick the Washington Post and others, that is what is giving them the revenue that is needed to sustain the business, not the physical one. The positive thing of newspaper is because it has that credibility. So when somebody is accessing it online, that credibility is there for you to ensure that whatever you are picking the news is authentic. And it really helps to fight this information and misinformation that we all think is a threat to us as a country. So they have to. And maybe management in Ghanaian Times, you know how some have been there for a very long time to come. Maybe they have to appreciate the new trend and train towards it and use it.
And perhaps I'm also looking at the cost of production these days. That could be a hurdle, knowing that we're in difficult economic times. All these newspapers will equally have challenges, even printing the papers itself.
Yeah, it's very expensive to do, and we cannot do without the intervention of the state.
Right.
Because it's an industry we are talking about.
Right.
We are
not just one.
Not just something.
One
and it's an industry that at the moment there are other demand for the news, where there are people have the options to go to the WhatsApp and the other digital platform to. So if the government refuses to see the need that newspaper is part of national development process, and whatever is published, like because in the morning, if you listen to a lot of radio stations, it becomes the raw material for discussion. So if government comes in to intervene, and the intervention is in terms of ensure that there's enough adverts by our laws, the national procurement policies, it's ensuring that any government institution must advertise what you want to procure. And therefore, to do it must be done in newspapers and others.
So if I get your point now, government could discriminate positively, or perhaps ensure that anytime advertisements ought to be done, it must be in every newspaper.
They can deal with the established institutions like Primpag, where we have membership over 70.
So you deal with
sit down with them and say, okay, this year the budget for government institutions in terms of adverts is maybe 1 million Ghana cedis. Can we cede 60% to the private sector? Then within the membership, you know how to redistribute it. And the impact that the government is looking for, we definitely get it. We are partners of development. When COVID came, I quite remember that we were called for discussion, and we gave them our words, and we were able to ensure that our members carry out the advert for them. And at the same time, we're able to carry the information from the right source.
But Emmanuel, this is, well, of course, another criticism we're facing as the media, that, well, if it comes to the money, if it comes to the revenue, you're there for it. But it's an individual venture as well.
Yeah, but what do we do at the end of the day? We all help national development. We are part and parcel of development of the country, whether it's an individual or it's a state institution. We all come in to be part. When the industry is not well protected, then of course we'll begin to have infiltration of people. Say politicians have taken over the media space. People are not well paid, and therefore they are easily influenced and others. We are looking for an area where members within the industry will be well trained so they can produce what is needed towards where the country wants to go. I was just watching this climate change issue. It's an issue that when the media decide to pick it up and speak about it, we are speaking to a level where, as a country, we are all benefiting from. So I believe that government coming in to help the industry to grow, we are doing it for Ghanaians. And before our democratic 1992 democratic institution, those in that industry, the Koku Bakons, the Kwasi Pratt, the Benepsins, and others,
played a very significant
played key role. So these people were industry players, and they were fighting for Ghana. So why now that very industry is left to die?
It shouldn't die.
It shouldn't.
Yeah,
it shouldn't.
Let's look at the way forward, and if there's a message from Primpag to government, especially through the Ministry of Information, because that's the sector agency that you'd have to engage on this. What would be the message? And are you willing to engage with government on this?
More than willing. More than willing. And Primpag, our position is if they see like it's a private sector that we are dealing alone, we cannot survive. Government must come in. We are not asking government to come in to influence what we write or we do. But we're asking government to consider we'll be part and parcel of the national development agenda. We'll be part of, if it's education, we'll be there. If it's health, we'll be there. If it's transportation, we'll be there. Any sector of the economy that is needed to ensure that Ghanaians appreciate what we are doing for development, we are there. So government must come in to help. And Ghanaian Times issue is not only management level, it's an industry problem.
I see. And we need to solve and deal with all of these issues. Any final message to those who perhaps may be philanthropic organizations and would want to help?
Let's also appeal to
That's critical.
Yeah, let's also appeal to corporate Ghana. Corporate Ghana, press release is common to us. When it comes to adverts, what they normally use as an excuse that, your paper
is too sharp.
It's perceived to be for NDC or MPP. But they are doing that to the industry. I always stress on the industry. But they have been doing it. If it's Democrat, so you are NDC. If it's Daily Guide, they say you are MPP. So none is benefiting from what corporate Ghana must do. So corporate Ghana, please, support us to survive. And when we survive, we'll be able to help you also survive better.
Indeed. And that's all we want. Tima, I'm grateful that you've been able to join us in studio.
Thank you.
Here. But let's talk about another industry that's facing a challenge. That's the Ghana Private Road and Transport Union. They've agreed to put on hold the proposed increment in transport fares. This follows a directive coming through from the Ministry of Transport to all the general public to disregard the announcement by GPRTU on the planned increment in transport fares. The GPRTU issued a press release claiming that at the national management meeting held at the Transport Union House on the 16th of January 2024, it was resolved that transport fares be adjusted upwards by 20% across board and all loading points of the union effective the 24th of January 2024. But the ministry says that there was no negotiation with these transport operators to review the fares. Speaking to Benjamin Akakpo on the AM show this morning, General Secretary of GPRTU, Godfred Bombri, said members have decided to heed the directive from the ministry.
Mr. Abubire, so are you going to stick with your increase? Even if you have this conversation with the transport ministry, are you still going to push for an increment?
You know, I heard that, I told you mentioned that the minister had asked put on hold on it. So definitely until you go back to them and then sit down.
No,
But
I'm saying when you go back to them,
yes.
that's what I mean. Will you still push for an increment?
No, the meeting will decide. But I'm happy he said that about 99.9%. I think if he had made it 100%, I would have said no. But I agree with what he said. But we'll go back to them and the meeting will decide.
All right. Gentlemen, Mr. Abubire and then...
Meanwhile, some passengers John News engaged this morning have been dismissing any attempt to increase transport fares. They say that the timing is wrong and will negatively affect them.
Drivers are about to increase prices. So, in my opinion, I think it's the poor management and increase of fares right now. And when government increase the price for it, affect the drivers as well. So right now, drivers are increasing it, and it will have an effect on the youth as well, especially we the students, because most of us, we are not staying around, and we are not having hostels too.
Since they are increasing transportation, I think it might affect me financially, and also when I want to come to town, because it has been increased, I have to double my transportation fare, which will affect maybe the things I'm coming to buy.
I said this year from Madina, Kokasua, this aggravator for some just saying, 20 Ghana. Maybe I do my try in 20 Ghana, maybe 20 Ghana, I'm saying. It is a part of many deal on another. Many deal, many so good.
Yeah, the transport fares in there, it won't help us at all because we, the workers, we normally take car every day. And the salary too is the same. So if they increase the transport fares, at least they have to also cushion us so that we can also be compensated for that losses. Because if we are, if my salary is small and then the transport fare too is increased, it's not the best.
And now Ghana is facing one of the Africa's football giants, make or break encounter later today in the ongoing Africa Cup of Nations. Some sports pundits say the odds are against the Black Stars, with the Pharaohs of Egypt being the favourites. Some Ghanaians are also pessimistic about the Black Stars' ability to end Ghana's 42-year-old AFCON trophy drought. We take you live to Ivory Coast shortly. Firstly, I want you to listen to the coach of the Black Stars, head coach Chris Hughton, and forward Jordan Ayew at a news conference ahead of the games.
He's going to be Ghana's night. You heard Chris Hughton there talk about the track record of Ghana never losing a second group game since 2000 and losing just one since 1992. He believes that that record that has served the country so well in the last 32 years is a good omen for the team. He also believes that the biggest motivation for each player who has been called up for this contest tonight is the fact that the team lost its opening game against Cape Verde. So it's important that every single player comes in with the right mentality, the right character, the right determination and hunger, and continue the history that has served this country so well. It would interest many people to actually know that the 4 times Ghana lost its opening group game, on 2 occasions, the country was able to make it to the final of the competition. And that was in 2010 and 2015. The other aspect that many people would also not want to hear is the fact that The 2 times they also lost their opening games. They exited the competition at a group stage, and that was in 2006 and in 2022 when the competition took place in Cameroon. But the optimistic aspect of it is the fact that many Ghanaians that I've had the privilege of speaking to, including supporters, when I visited their camp, and in fact, I posed a question to them, just as I posed a question to Chris Hutton yesterday, and many of the supporters are saying that if that is what history has served Ghana so well, then it means that tonight is going to be Ghana's night. So everyone comes into this stadium tonight hoping that the Black Stars would at least walk away with a point.
To see what the outcome will be, Mufta Nabila Abdullah joining us from La Côte d'Ivoire. And that's all we have for you in this package of the Pulse. For more news, log on to myjoyonline.com. I'm Lester Suga. We'll leave you with Let's Talk Showbiz.